The summary again is noradrenaline is synthesized in neuron axons, while adrenaline is synthesized in adrenal medulla. Now this dopamine, this is a precursor of these two. The same way, if there is too much noradrenaline in the synaptic cleft, it goes back and sits in the alpha-2 receptor. So the alpha-2 will tell this neuron, stop producing more noradrenaline. Okay?
कर्मस्य कार्यं जातकर्मं कुमारस्य कार्य. That is, after prana pratyagamana, jatakarma comes. So in that process, the first thing is
causes this plaque accumulation and thereby this periodontal destruction. Now, as you know about root, if you take a tooth into consideration, we have the crown and the root, or more specifically the root complex. This root complex, as you can see in the image over here, is divided.
There's a little bit. Because it's for 2 marks, fine, it's only for 2 marks, so it's okay. If they give it for 4 marks, just explain.
Okay.
And optics changes. See, you won't get 6 marks for this. Because you wrote only 2 things. Yeah, I can understand.
Basically, 3 elements. What are the 3 elements? You know, cells, intracellular substance, and body fluids. So
means exhaustion. Then samruddha mutra anila bit, that is retention of urine, flatus and feces will also be seen in anaha. So vishala sabdada nayanam, parva vedam, aradh kalami, samruddha mutra anila bit, vishishur anaha vedina. Vedani.
Start with somatic. You have a motor neuron, say your medial nerve or your ulnar nerve, okay? It goes till your skeletal muscle, correct? So how does it reach? The nerve, when it reaches, what neurotransmitter goes through? It is the acetylcholine.
This is GG drill, large type GG drill.
Okay.
This is a barb roach.
Okay.
First, with this you make the access cavity.
Okay.
After you make the access cavity, you use this barb roach to remove the pulp.
Okay.
After you remove the main pulp, there will be a little bit of remnant pulp present.
Yeah.
For that, you use these files or you use these nickel titanium files. And if the canal is very narrow, you use these GG drills to increase the diameter of the canal and then do it.
Okay.
So now we understand.
In the postsynaptic neuron, we can see numerous receptors for these neurotransmitters. Okay, neurotransmitter receptors will be there, and what happens is these neurotransmitters that are being released, they will attach or they will come in contact or they will bind to the receptors on the postsynaptic membrane.
Karnavedana Samskara is the procedure where the child's ears are pierced for the purpose of protection and as well as ornamentation. So, according to Sushruta and Vagvada, it is done on the 6th, 7th, 8th
and interact with various type of, and these antibodies, right, interacts with various type of antigens. The different types of antigens, example is RBC membrane antigen like blood group and RH antigens. Then extracellular matrix antigen. So this,
it's just the outer part. So this entire mass forms the basal ganglia, and this green part, it is the corpus striatum with the caudate nucleus. Then comes substantia nigra, which is the
and they can get other to this pellicle. So attachment of this calculus is to the pellicle. Okay. So 5 pellicle. Okay. Then this pellicle formation is actually seen in cinnamon. So if this is said to the
Acetylcholine released, they act on postganglionic or motor end plate on the acetylcholine receptor.
So see here. So this is the pectoralis major muscle. So it's cutting and removing. It's reflecting now. So pectoralis major is over. Now this is the pectoralis minor. So this also.
So introduction, actually amino acids are building blocks of protein. So before entering into amino acid, we must know what are proteins. Okay. So proteins are the most abundant class of organic compounds in human body. which mediate every process that takes place in the cell. And these proteins are polymers of amino acid. That is the definition. What is the polymers of amino acids?